Hi everyone, good evening. So we'll be doing an Instagram live with a good colleague of mine, and we'll get him online very soon.
Hello, can you hear me?
Hello, hi Anand.
Hi.
Hi Dr. Anand. I don't think so. I can get visual on you.
All right.
Is your internet good? Or hi everyone. We're waiting for Dr. Anand to come on, and we'll be starting around 5:30. Yeah.
Hello, can you hear me?
Yeah. Hi. We see you.
Hi. Sorry. All right. Very sorry about just now.
Yeah, Anand, you have to turn the
Okay.
camera and focus.
All right.
Okay.
Can you see me? Can
Yeah.
you hear me?
Hi, everyone. Thank you for joining us today. We'll be having a short talk with my good friend, Dr. Anand, who's actually known to me for more than, I don't know, 30 years maybe, or more than
Yeah.
that.
Right.
Anyway, we'll be starting soon. Dr. Anand, we'll
Yes.
just wait for some people to join. So we'll start in minutes exactly, yeah?
Sure. I'll just get
You can get
camera ready.
adjusted. Hi, Dr. Nita. Hi, Dr. Shasha. Thanks for joining us. So we'll wait for exactly 2 minutes and then we'll start. Yeah?
Okay. Can you hear me, Sanjiv?
Yeah?
Yeah.
Yeah. Can your visual? You gotta focus. Yeah. Yeah. Looks.
Better?
Yeah.
Okay.
Good. I think, shall we start in about a minute?
Yeah. Can.
Yeah, we'll let everyone come in. Okay. So hi everyone. Good evening. And to Rampal Surgery.com and welcome to our Instagram. Today we'll be having a friend of mine, Dr. Anand, from uh, from Clang private institution. We'll be talking a little bit about uh, our experience in dealing with patients with chronic pain. Yeah. So just Anand, I think the sound uh, is
Sorry?
okay. Your connection okay? Anand? Yeah.
Sorry, you
Now
can hear me?
I think your background sound.
The background sound, okay, all right. Let me try to reduce the background sound. All right.
Okay. Yeah. Much better.
Better? Okay.
Okay, guys. I'm Dr. Sanjiv Rampal. I'm a orthopedic consultant here, and I have a good friend of mine who's a pack abuse or anesthesiologist, and he'll be joining us today to talk a little bit more about how he deals with patients with chronic pain. Yeah, as we all know, sometimes we have. In the healthcare system, we have patients who come for all kinds of reasons for pain. Dealing with pain is quite, it needs experience and it needs care. And dealing with pain usually depends on a lot of things. It's multifactorial. It depends on a lot of things, including how you got it and how bad your operation is, or I mean how bad your trauma is, or if it even involves trauma. There's always an element of psychology involved when we're dealing with pain, and that's the aspect we're going to talk today a little bit about, because I'm used to dealing with calcium and bones, and dealing with pain and dealing with psychology is a little bit more, or I would think a little bit more expertise of another doctor. So today we are fortunate enough to have a good friend of mine here to join us, to maybe share his experience and also his expertise regarding the matter. Yeah. So one of the main ways how we're dealing with pain during, especially when we change the environment, as we all know nowadays, we are having the pandemic, and people are exposed to different kinds of stresses nowadays. They're exposed to more indoors and limitation of movement, and also social integration, and also the interactive among them is reduced. So it does cause a different kind of scenario, which can propagate or can make pain or chronic pain become worse. So dealing with that, I have invited a good friend of mine to maybe share his experience in dealing with them. So usually I deal with them when patients in the public sector, where we have patients who have had a severe injury or have even chronic arthritis, and they can't deal with the pain. And there's always some form of psychosocial involved with it. And I think I thought it was a nice avenue for us to get some form of specialist on his opinion. So without further ado, I'm gonna invite my good friend Dr. Anand to share with us a little bit more about his experience. So maybe first of all, hi Anand, thank you for joining us.
Yeah, hi. Thanks, Rampal.
So as you all know, Dr. Anand is an experienced anesthesiologist in the private sector, and maybe I'll let him introduce himself. Yeah, Anand, you want to take
Hi.
it?
Sure, thanks. So, hi everyone. I'm Anand. My main role in my hospital is I help patients to have a better experience in their anesthesia journey. And besides that, my secondary role obviously is to help surgeons to give a better treatment plan for their patients during surgery itself. So part of anesthesia is pain management. So that's what I do. Intra-op, pre-op, and post-operative pain management. Uh, I'm attached to a private hospital in Klang Valley. Um, Pain management is a very difficult topic, simply because pain is a subjective experience. It varies from person to person. A subject A may say um, a needle prick from 1 to 10 pain score is 1. Another person may say is 10. One person may just need 1 milligram of morphine for surgery. Another person may need 10 milligram of morphine for surgery. So it varies from many patient to patient. Not only that, type of surgery, not a, it is there are multimodal drugs being employed in manipulation of pain. So as anesthetists, we are trained to manage pain pharmacologically. Unfortunately, the non-pharmacological methods are there out there. Uh, we medical practitioners are not well exposed or trained in non-pharmacological methods. So I believe that both methods are equally important to have a better pain management for any patient. For any patient. So
Yeah,
that's what I do in my place.
what what uh, what what you meant by that. Now, can you explain to us exactly how does hypnosis actually help in managing pain, Dr. Anand?
All right. Uh, Hypnosis is just one of the tools that we use to manage pain. So obviously, the first main pathway will be identifying what kind of pain is it. So depending on nature of the patient, whether the patient comes in for surgery or it's a post-surgery, so either it's acute pain or chronic pain that we are familiar with. Uh, Not only that, we have to further down break down either to two types of main categories of pain where we know we have nociceptive pain. Nociceptive pain means pain that's induced by nerve injury. Or another kind of pain is pain from the tissue itself, tissue damage itself. So once we identify and classify that type of pain, then we can have a better choice of drugs, what to use. Drug choice is important, then the other tools are coming, probably like physiotherapy, rehab therapy, massage therapy, those kind of things. But I personally find that because I'm passionate in hypnosis as a tool for pain management. So I use my hypnosis method in reducing pain. How does it help? Is hypnosis a procedure which involves cognitive processes such as imagination, in which the patient is guided by a health profession to help the patient to respond to suggestions for change in perception, sensations, thoughts, feelings, and behaviors in regards to the pain they perceive. By hypnosis is not a way to remove pain. It is a way to teach patients to manage pains better. Pain is an important sign to tell us something wrong with the body. So it is a very good indicator. But to learn to manage pain is a choice, and patients do not have to suffer with pain. So briefly,
So,
that's how
Doctor,
we use.
saying that hypnosis is the all answer, or do you incorporate that into your management or other people's management of pain relief?
Of course, it's not an all answer. It doesn't. Not everyone is suitable for hypnosis. Some patients may benefit other types of modalities, for example, TENS, where the physiotherapist applies certain ultrasound devices on the injured part. Uh, Hypnosis is just a tool to manage pain if patient consents, if it's suitable for the patients. Um,
So is it,
yeah.
sorry, because I have no personally I have seen people present. I think I've told you too. I've seen people. I mean, not people, but doctors explain about hypnosis in treating knee pain, chronic knee pain, and also chronic back pain as part of their overall treatment. Yeah, but in Malaysia, is our exposure is very limited. I have not seen exactly people incorporate that locally, but I'm not saying that it's not a valid way. But in Malaysia, the people who are trained in this field is very few and beyond. So may I ask you something that what the common man would like to know? Is this addictive? Is it
Addict.
hypnosis? Is it addictive that once you not do hypnosis, or is it like something like meditation or something like that?
Yeah, it's a very good question. Uh, Hypnosis is very popular in the Americas simply because in America has a endemic called morphine, opiate endemic. So one out of three patients in US are prescribed morphine. So therefore, they are trying to move away from morphine, opiate-based pain management. That is why regional anesthesia. Regional anesthesia simply means giving certain blocks, certain pain relief to certain parts of the body. For example, if a person has just arthritis of the fingers or the joints, they give certain blocks of the nerves to minimize the usage of opioids. So therefore, a group of people who are interested in minimizing use of opioids have branched out, and hypnosis is a way of it to support pain management. So the answer to the question is whether is it addictive? Answer is definitely not, because it is a tool to fight the opioid misuse in the US. So therefore, it is getting more importance to reduce the dependence against opioid. It is not addictive. So how does it do? Is a patient just goes through imaginative process similar to meditation, becoming more relaxed, tuning their mind to reducing their stress, reducing anxiety, because anxiety and pain go together. So once you decouple pain and anxiety, the pain is manageable with your pharmacological agent, with your drugs, or even with other techniques. So that's how it works.
Yeah, and then Dr. Anand, what about who will be an ideal candidate? Like what kind of patients? Like, we have all kinds of patients, all kinds of patients, right? I know it can be applied in most of the patients, but which would be the ideal kind of patients that you think that would be, would benefit from this kind of methods of?
Yeah, very good question. Instead of me answering ideal kind of patient who's suitable, most patients are ideal for hypnosis. But let me share with you patients who are not ideal for this. Patients are not suitable for this method. Patients who are not suitable for this method would be a patient under psychiatric care who is not being diagnosed and not on medication. For example, a bipolar or schizophrenic who is not diagnosed or underdiagnosed or not on appropriate medication yet. Number three would be simply a patient who refuse any form of psychotherapeutic intervention. For example, a person simply says, I do not want talk therapy, I do not want to relax, I just want medication. So if a consent is not given, you can't do this form of therapy. And the other type of patient which we would not do is if the patient themselves have a restrictive view, a cultural view, or certain belief about hypnosis, then it is a no-no. Otherwise, it is for anyone for the matter.
Excellent. So, Dr. Anand, would you like to give us a take-home message or something to summarize what our benefits of hypnosis in dealing with chronic?
I think for chronic pain or even any sort of pain, I think anyone or everyone should equip themselves with certain knowledge. Talk to your doctors. What are the other options available? If you're not suitable for certain medication, probably other medications are there. Or if the medication is not a choice, to add on to medication, probably certain physiotherapy or even hypnosis, other forms of therapy that are out there. Equip yourself with knowledge. You can Google is there, pain management. By equipping yourself with certain knowledge and information, I think the pain management can be dealt better.
Yeah. So, Dr. Anand, sorry, just the last question. How much is this therapy cost comparatively to other methods of dealing with pain? Because there are all kinds of pain management methods, including physiotherapy, physical therapy. There's counseling, there's psychological counseling, there's other methods of dealing with it. And is it applicable in the Malaysian system? And does it require any form of and who provides these services too?
It's a very complex question. Who provides the service? Many doctors in Malaysia provide the service. I think you should speak to your doctor. If it is your surgeon, you speak to your surgeon. Probably your surgeon can refer to appropriate qualified person. Regarding the cost, it varies from person to person. It varies from type of problem. It varies from length of treatment care. Again, the best person to talk to is to your local doctor to have a complete overall holistic care for you. It is not that straightforward. Yes, even for physiotherapy, you need a certain package. You need to go through a certain routine or process. Same goes for hypnosis. So I would definitely advise you speak to your doctor. They will have better information about this.
All right. Thank you so much, Dr. Anand, for spending your time with us today. And for everyone who's joining in, if you have any questions, you can direct it to Dr. Anand, who is based in a local private hospital over here. And you can message down here too, and we'll try to answer you. For everyone on the platform, on Monday, we'll be having Mr. Rishi Rampal, and he's He's the COO of Hitman Group, and he'll be talking about how the pandemic has affected his industry. That's mainly events industry, and we'll be talking a little bit more about him. Yeah, thank you so much, Dr. Anand, and we hope
Thank
to
you.
have you again later on in the year. Yeah, wish you well. Thank you so much. Bye bye.
Thank you.